Hey everyone, today we're going to go over pharmacology basics in math. We're going to go over conversions and then lots of practice questions. You're watching me, Dr. Kendall Wyatt. From paramedic to registered nurse, now turned physician, I've been told I'm kind of nerdy. But that's only because I never stop learning. If you'd like to check out something I've been part of the past few years, check out Picmonic. The link's in the description. Oh, and don't forget to subscribe to my channel for my newest videos to help you get through your next exam. Today, we're going to go over conversions. Now, not just one or two conversions. We're going to go over a bunch of different conversions you need to know. And these are the most basic things you really got to get started with in nursing school, and then lots of practice questions to get you comfortable. So you can get started and, I don't know, be great at math. Because isn't that what everybody wants to do? Be great at math, right? Yeah. First off, I just want to kind of show you this chart. It's got lots of stuff on it, lots of numbers. Really, it's all the stuff you need to remember. Now, we've got a little link down in the bottom of the video, so you can go and download 2 pages of all of these things you need to know. But this is the core of it, and then a couple of the other charts that we're going to show you later. So as we get started in conversions, the first thing is the lovely U.S. system, right? Well, the U.S., it likes to be special, and so we have our own system. And it's really important that you need to memorize a lot of different numbers. Now, there really aren't that many to memorize, but if you don't use them all the time, they're hard to remember. They're hard to keep track of. Well, the first thing is our ounces. So ounces, you've got to kind of remember that 1 ounce is equivalent to 30 milliliters. Now, almost everything in medicine is milliliters that you're going to see. It's not until you go in the nursing world where you have these calculations on your test, but also the things you need to know are typically asking all of the things in the US system and asking you to convert to mLs. So at the most basic, if you know milliliters, 1 ounce, it's about 30 mLs. Now, I'm going to ask you again later, but technically, if you want to get technical, it's like 29 point something. But you can remember 30 mLs. That's what you need to remember. 1 ounce is 30 mLs. Now, as we go bigger in the US system, 30 mLs, 1 ounce, right? Well, then we go to cup. Well, how many ounces are in a cup? Well, there's 8 ounces in 1 cup. So 1 little cup, cuppy-roo, cup, there's 8 ounces in there. So you got to remember that. So if I were to ask you, how many milliliters are in a cup? You would be able to remember what? Well, the thing you've got to do is calculate a lot of these things for all of your math equations. And this is what we're going to do as we go through this. And then we're going to get a little bit more complex as we go along, of course. So how many mLs are in 1 cup? Well, you can know, of course, that 1 cup is equal to how many ounces, right? Well, 1 cup is equal to 8 ounces. So 8 ounces. But 8 ounces doesn't equal mLs, right? Milliliters. No. So what you need to do is you've got to take your 1 cup and remember that it's 8 ounces. So 1 cup equals 8. Then you take your 8 ounces and you multiply that by how many mLs are in each ounce, which is 30. So 30 times 8 would give you 240 milliliters. So this is pretty basic, but you've got to get this concept. And what I like to always do is you have to say, well, in any question that you run up against, you've got to just stop and say, what is the question asking me? What's the form that it's asking me in? Well, the question is asking me in mLs. The question is me asking in how many paper sacks of something, right? No, not really. But what if it did? You've got to know that. What is it asking me? What unit of measure is asking me? And then you've got to say, what unit of measure do I have? Well, if you have cups and you've got to get to mLs, well, you got to get there some way. Now, maybe you already knew that it was 240 mLs. Great. Don't try to memorize all of those different numbers because it's way too much. You've got to be able to quickly break it down. 1 cup is 8 ounces. 8 ounces is 30 mLs. 1 times 8 and 8 times 30 is 240. So you get 240 mLs. So let's go on and move up to some bigger ones. So if we have cups, cups are fun, right? Cup. But also we've got pints. Now, the only pint I know is, well, never mind, we're not going to go there. But 1 pint, well, what's the size of a pint? Well, a pint is equal to 2 cups. 2 cups equals 1 pint. How much is a cup again? How many ounces? 8. So if I were to ask you, how many ounces are in 2 cups? Well, then you'd say 2 times 8 is 16. 16 ounces is a pint, right? That's exactly right. And that's what you've got to be able to calculate these through. Now, the next size up is 1 quart. 1 quart is equal to 2 pints. You see a pattern here? 2 cups, 2 pints, 1 quart, right? Just kind of gets bigger. Now, what if I was to say we go to gallon? Well, so how many quarts now are in a gallon? 1 gallon is equal to 4 quarts, and that's where it just gets confusing. So what I always remember is that 2 cups, 2 pints, 4 quarts. And I kind of remember that because, they get bigger, but 2 plus 2 is 4. So 2 cups, 2 pints, is 4 quarts. So that's where I remember the sizes. And I get it mixed up, and I always have to stop and think and really think about the layers of how they go every single time, even now. I stop and I have to look at my fingers, and I can't even remember from my left from my right some days. So don't feel bad. Now, what if I ask you how many ounces are in a gallon? Now, maybe you memorized it. Okay, fine. That's not what you really want to do because it's a lot of numbers, and the likelihood that you mess those up it grows exponentially the more numbers you try to memorize. But if you know how many sizes are in each one, then you can calculate. So 1 gallon is equal to 4 quarts, right? So 4 quarts, and you could say, well, how many cups are in a gallon? You could do that and then calculate that by 8 if that's what you want to do. But what I like to do is just think through the whole thing. So I say 1 gallon equals 4 quarts, and 1 quart equals 2 pints. 1 pint is 2 cups, and 1 cup is 8 ounces, and 1 ounce is 30 mLs, just like we did over here, right? And what you can do is you can multiply all the numbers. So 4 quarts times 2 pints times 2 cups equals 16 cups, right? 16 cups in 1 gallon. And if you remember 16 cups, you could memorize that number. That's a good one to remember. Then you could say that 16 times 8 ounces in each cup times 30 mLs would give you 3,840 mLs. Now remember, the 30 mLs is an estimate. It's like 29.6 something. I can't remember right off. I've got it on a slide here, but I never memorized it because I know it's about 30. And that's what you really got to remember because it's an estimate. You're not going to get super finite numbers like that most of the time inside of the math. But here it is again, just to show you that all of these all the way across the board are equal. 1 gallon is equal to 4 quarts. 4 quarts is equal to 8 pints. 1 gallon is equal to 8 pints, and these are all equivalent across the board. 16 cups is equal to 1 gallon, 128 ounces, or 3,840 mLs. And of course, that's approximate with our mLs. So you could memorize this, and this is in that handout sheet that you can get if you just look down at the bottom in the information section. It's got all those, this exact one in there. All of those are equivalents. So there's 8 pints in a gallon, there's 16 cups in a gallon, there's 4 quarts in a gallon. That may be a better way for some people. I teach this different ways. Some people like the top part, how we've got it up here to memorize which one goes into which. Some people just like to memorize this entire chart right here. So you remember 128 ounces in a gallon, you remember 8 pints in a gallon, and then you can divide across these to calculate out whichever one you want. That's up to you. Next, I want to go over to the most important thing you've got to know. Now, of course, everything's the most important. That's a little tidbit. I just lied. But what you really must know, or you're going to see a lot, are pounds and kilograms. You've got to know it, and you've got to be able to not mix it up. And you got to be able to do it on the fly. Because this is something you just don't want to miss points on, and you don't want to mess up in the real world either, because you make some really embarrassing mistakes. Pounds and kilograms, I've got a little Picmonic character in here for anorexia rex, which you can check out in the Picmonic learning system, but I just like this little character. He's so cute. What is 1 pound and 1 kilogram, right? You've got to be able to go back and forth. Well, what you've got to remember is you've got to memorize it. 1 kilogram is equal to 2.2 pounds. It's approximation again, 2.2 pounds. Now, when you think about these pounds to kilograms, the only thing you're going to mix up, which I used to do it all the time, is do you divide, do you multiply, which one do you have, what do you do, right? Well, it's actually pretty easy. I like to use a logic check. Well, what's my logic check? Well, it's kind of crude, but I remember that the pounds numbers are always higher. Now, how do I remember that? Well, pounds are what we use here in America, and which one's always bigger if we were measuring weights? Americans, right? Of course, exactly. So remember that pounds are bigger. So the number that you're getting should be larger if you're converting from kilograms to pounds. Now, the other one that I like to use too is to make sure you know your own weight. Calculate it out and put it in your mind. Because which one do you want to remember on a number if you're measuring your weight? Well, you want to know kilograms because it makes you look thinner because it's smaller in the metric system. And that's what's really important. So if I had 100 kilograms, what's 100 kilograms in pounds? Well, 100 times 2.2 is 220 pounds. And that's another, you can just also think about that as well, but compare it to yourself. And of course, you can say whether you're more or less than 220 pounds, but you can keep that to yourself. Now, if Dr. Wyatt weighs 135 pounds, what's his weight in kilograms? Well, of course, it's very, very, very small and light, right? Because I don't eat Cheetos all the time. I don't. No, it's not true. Now, 135 pounds. Now, you need to go to a smaller number because it's kilograms, right? So do you multiply or divide? Well, to do a smaller, you're going to divide. So you take 135 divided by 2.2, which is kilograms, and that's going to give you Dr. Wyatt's weight. 61.36 kilograms. I like that. I think I'll take it. Now, you can calculate your own weight out. And, I don't care if you lie or not, but use an approximation so you remember. But make sure you know your own weight in kilograms. It's really important because then you can always remember. Next, let's move on to milliliters and ounces. Definitely something you've got to know. Now, we talked a little bit about milliliters to ounce. Remember, 1 ounce equals about 30 mLs. Well, I could never remember that it's 29.57 because you know what? It's not really that important. Now, maybe you've got an evil instructor out there. I know, I've had one too. And they want you to know 29.57. Well, sorry for you. However, remembering 30 is so much easier. And it's pretty much straight on for the math. But how can you always remember mLs to ounces? What's a good way for you to remember? Well, I always like to remember 16 ounces because it's a nice popular beverage size, right? And 16 ounces is times 30 mLs, about 480 mLs. Now, why did I tell you that? Why is it important? Well, there's a really great example out there that you can apply to real life, which I absolutely love, and you may have been wondering. Now, if you bought a water bottle, everybody bought a water bottle and destroyed the environment a little bit with the plastic, right? Yeah, guilty. Now, what about those water bottles? Why are they 16.9 fluid ounces? Why? Well, what if you did the math? What is a 16.9 ounce water bottle in mLs? Well, it's really important, and it helps you memorize. They're that way for a reason. Because how many mLs is 16.9? Well, if you multiplied it by 30, you're going to get a weird 504, 506, whatever it is in my head, I can't remember. But if you multiply it by 29.57, you'll get a wonderful, beautiful, even 500 mLs. Isn't that convenient? You can use that example to remember that those crazy water bottles, now I'm not talking about the one you buy at the gas station that's 20 ounces, because, that's cheating. I'm talking about the ones you buy in the 24-pack that are cheap, 16.9 fluid ounces, and they're 500 mLs. Super easy to remember. That way you can apply something you know to something you don't know, and you won't forget. That's really the best thing to remember about when you're learning something. Take something you don't know, apply it to something you do, and then you can remember. Now, another important fun little tidbit fact, of 500 mLs of water, how much does that weigh? What does it weigh? Well, conveniently, 500 mLs weighs approximately 1 pound. And that's another fun fact that you can remember. Now, moving on to inches to centimeters. What do you need to know about inches to centimeters? Why are they so important? Well, you got to measure wounds, you got to measure all this stuff, and you need to know inches and centimeters. Super important. Now, when you think about inches and centimeters, 1 inch, equals about 2.54 centimeters. Don't forget that one. 1 inch, 2.54 centimeters. Now, I would like to think that I'm super tall. Someone once said, you're as tall as you feel. And I feel like I'm about 6'3", I'm just saying. Now, unfortunately, Dr. Wyatt is 66.5. Don't forget the 0.5. It's very important. Very proud of that. 66.5 inches tall. What is my height in centimeters? Now, if you think about it, there are lots of ways to do this. Well, not really. 66.5 inches multiplied by what you need, 2.54 centimeters, equals what? Well, 66.5 times 2.54 will give you the answer in centimeters, and that's approximately, or exactly, 167.64 centimeters. That's what you need to know. So that's right, 167.64 centimeters. I feel so much taller in centimeters. I know, right? I love the metric system. I feel taller. I feel skinnier. I love it. That's all I got to say. Now, when you think about this, what I want you to do is I want you to know your own height. Because you know how many inches you are tall, right? Well, everyone wants to be a little taller. So I want you to make sure you convert your own height to centimeters so you know what it is. And it also gives you another great example. Now, why do I have this beautiful ruler in here? And it's not to make you remember, second grade when you got hit by them. That never happened. I was good in second grade. I was a great student. No one ever hit me with a ruler. That's for our psych video, for therapy. But you can remember the ruler because it's a really good example to help you, again, put a real-life example. Now, if you've never seen a ruler, I don't know what to tell you. But a ruler typically is two sides, and one side's in inches and the other side's in centimeters. So, how long is a 12-inch ruler in centimeters? Well, you can do the math, right? 12 times 2.54 is going to give you approximately 30.48. And you can remember that really easy because one side's 12 and the other side's 30, but it doesn't go all the way to the edge. I always wondered that in grade school. Now I know why. Whatever. Now let's move on to another really important topic. Teaspoons and tablespoons. I hate these things. Let me tell you what. Number one, because I got some at the Big Lots and they're not the right size. They're not real teaspoons and tablespoons. Now, I'm not knocking Big Lots, but I don't know what happened to them. That's all I got to say. But they're not right. Now, what's important to know about teaspoons and tablespoons? You're going to get a lot of dosage questions about these because they're tricky. And I think they're a little slightly evil because you just have to memorize them. Well, what do you want to memorize them with? There's a couple different things. First off, you've got to remember that a teaspoon is 5 mLs. Now, it's a beautiful teaspoon. That's nice little rounded edge or, whatever. 5 mLs, really important. But what's a tablespoon? Well, a teaspoon is equal, a teaspoon's 5 mLs, and a tablespoon is equal to 3 teaspoons, right? Okay. But you could also just remember that a tablespoon is equal to about 15 mLs. So 1 tablespoon is 15 mLs, or 1 tablespoon is equal to 3 teaspoons. So you could say that you could do the math there. So 5 mLs times 3 equals 15. That gives you the answer. So let's do a practice question. And this is where we start applying more and more questions to real-life scenarios that you're going to encounter in the real world and on your exams. So you're to administer 15 mLs of medication to your patient, but only have a teaspoon. How many teaspoons should you give? Now, a lot of people get questions like this, and they just obsess over how do I set up the question? How do I do the little graphs, and which one do I put the number where to multiply, blah, blah, blah. It gets so confusing. But what I want you to do is say, what do I have, and what do they want me to give? Well, I need to administer 15 mLs of medication, so it's in mLs. But all I got is a little old teaspoon. I hope you don't have the Big Lots teaspoon. I hope you have a fancy teaspoon from the Walmart or somewhere. Anyway, a teaspoon. Well, how many? You need to convert everything to the same unit. So how many teaspoons is 1? Well, it's 5 mLs. So if you have 15 mLs of medication to give, 15 divided by 5 is going to give you 3. So you can take 15 mLs divided by each teaspoon, which is 5 mLs, and that's going to give you 15 divided by 5, or 3 teaspoons. I hope I didn't mix that up when I was crossing my words. I'm a bit dyslexic. Sometimes it gets a little confusing for myself. But if you get confused, write it out. And what you need to remember is compare it back to what you're doing and say, well, work backwards. If I use 3 teaspoons and each of them are 5 mLs, well, then I multiply. That's going to give me 15 mLs of medication, which is how much I need to give. With these types of questions, I always go back and do a logic check to really make sure that that's what I'm supposed to do. Let's move on to some more fun and exciting stuff. The metric system, right? Depending on where you're at in the world watching this video, You may find this part easier or a little more difficult, depending on how familiar you are with it. Now, I'm not going to go into the super details of each one of these, but you really kind of need to know what these mean. First off are the big ones. Kilo. You've got to remember that kilo itself means 1,000. Now, kilogram means 1,000 grams. So 1,000. Kilo is 1,000, 1,000. And then hecto is 100. And then you've got deca, which means 10. So a deca is 10, 1, 0. Then essentially you've got 0, and then everything else is divided by. It's a percentage, right? So we have deci. Now, deci is 1/10 or 0.1. And remember, every time we're doing pharmacology math, never forget that leading 0. I have so much fun marking questions wrong and answers wrong when people don't put that leading 0 in there, because in the real world, when you go and you put dot something, you don't know whether there's a dot there. Let me tell you how many times that dot doesn't show up. And if there's a 0, that way you know to look for a 0, because you don't write numbers that start with 0 normally, unless it's a percentage or a fraction. So deci is 1/10. Centi, remember a centimeter, is 1/100th. That's 1 divided by 100, 1/100th, 0.01. Milli, we're going to talk about in a second, is 1,000th. So 1 divided by 1,000, or 0.001. And of course, micro is 1,000,000th, and that's 0.00001. Now, another important thing to remember that I put on here, and I see this confused a lot, is that 1 milliliter, right? 1 milliliter of volume, 1 milliliter of volume is equal to 1 cubic centimeter, or a cc. So 1 ml equals cc. So if you need to give 50 cc's of something, that's 50 mLs. You need to give 25 cc's of something, that's 25 mLs. Don't mix that up. And that's just something that I see thrown in there. Just love to confuse people with that one, because it's, I don't know, fun and evil. I don't know. Somebody needs something better to do, right? Now, as we move on to conversions and we talk about the metric system, we need to do 4 big categories that you're going to see on almost all of your exams: kilograms, grams, milligrams, and micrograms. kg, g, mg, and mcg. When you're reading questions and you see examples, you've got to pay attention to what those little letters say. And for somebody like me who barely pays attention to what I read, you've got to see mg and mcg, and you're going to mix it up. Don't be that person, because those are easy points to lose. You're just going to feel dumb. And it's really hard to kick yourself more than 5 times in one day, right? Let's look at some examples. So what's really important when you are converting these, if you're going from kilograms, something large, all the way over here to something small, you need to multiply the numbers. So you multiply to go smaller. Well, what's really important, if we're going from kilograms and I need grams, well, I know I need to multiply by 1,000. And that's what we're going to do in these examples today. From grams to milligrams, again, multiply by 1,000 and so forth. But what if I'm going the other way, right? Or sorry. What if we're going the other way? Well, we need to divide. So if we're going from micrograms to milligrams, milligrams to grams, or grams to kilograms, or all the way across, we need to divide those numbers. So we divide the number we need to get to the larger number. And we're going to work through some examples, because this probably sounded confusing. If you take 1 kilogram, right? 1 kilogram. Now we know 1 kilogram is equal to how many grams? Well, 1 kilogram, we're going this way. So 1 kilogram is going to be equal to 1,000 grams. Now 1 gram is equal to 1,000 milligrams. So we'll see how we're going across here. And 1 milligram moving over is equal to 1,000 micrograms, sorry. And we're going to use this as we go across and as we practice, so you can follow along, and with our practice questions that we're going to do here in a minute. So 1 kilogram. 1 kilogram equals 1,000 grams, 1 million milligrams, and then 1 billion micrograms. I know, right? So how do we get that? Well, we take 1 and we multiply again by 1,000 to get 1,000 grams. 1,000 times 1,000 is 1 million, and 1 million times 1,000 is 1 billion micrograms. Now, if you're the kind of person that moves the decimal point with the little line, that's great. You can do that too. But I'm not going to go over that example right here, right now, because it's a little bit confusing for what we're going to go over. If you use that method, great. You can still follow along, but use your little decimal point. Just slide it on over and write on your paper. That's up to you. Let's move on. Now, what if I have 5 kilograms? So 5 kilograms equals how many grams? 5,000. That's right. So 5 times 1,000 equals 5,000 grams. Now, how many milligrams? 5 million. You're catching on. And how many micrograms times 1,000 is 5 billion micrograms, right? Yeah, I know, right? I did pretty good. So let's do some examples that you actually have to do some math at that you can't do in your head. Now, see if you can do these yourself. If you need to pause it, fine, because I kind of talk fast. I get excited. But we're going to go over lots of different examples to see if you can get them. And then we're going to apply to real-world questions in a moment. So 4 grams. If you have 4 grams, how many milligrams is that? Did you say 4,000 milligrams? That's right. So 4 grams, we're going this way. We're going over here. So times 1,000 is 4,000 milligrams. That's right. Now, what about 0.25 grams? You're going to get a lot of questions that try to trick you like this. 0.25 grams. 0.25 grams is how many milligrams? Well, 0.25 times 1,000 is 250 milligrams. Did you get that right? Good. You're so smart. Now, what about 1.25 grams? 1.25 grams is equal to how many milligrams? 1,250. Right. 1,250 milligrams. Again, 1.25 times 1,000, 1,250 milligrams. Great. Now they're going to get harder. Yes, I know. We're working up to it. Just calm down. Just stop screaming at the screen. We're going to get there. Jeez, they get hard. There's tricks. 800 milligrams. 800 milligrams is how many grams? Changed it, didn't I? 800 milligrams is how many grams? Well, now we're going 800 and we're going to a larger gram. What do? Well, we need to divide. 800 divided by 1,000 equals 0.8 grams. That's correct. Now, when you're writing this 0.8, don't forget that little 0 point, or you're going to get it wrong. I'd mark it wrong, and I'd have so much fun marking your answer wrong if you just don't even know. It would be great. I'd be so happy. Just a big red X. Let's move on. Sorry, I had a moment. 500 grams. 500 grams equals how many kilograms? Well, we're going that way, right? 500 grams is how many kilograms? Well, 500 divided by 1,000, 0.5 kilograms. Again, don't forget your leading zero. What about 2,150 milligrams? 2,150 milligrams is how many kilograms? Now we're getting tricky. Well, what do you do here? Well, 2,150 milligrams. Well, you're going to grams and then to kilograms, right? So you divide 2,150 divided by 1,000, and then you divide it by 1,000 again. Don't forget the steps. Sounds really stupid, but you don't want to miss those easy points. So 2,150 milligrams divided by 1,000, then divided by 1,000 again is 0.00215 kilograms. And this is where those people who move the zero across 6 spaces could make themselves maybe go a little faster. But it gets more confusing. I recommend doing the math. 2,150 divided by 1,000 divided by 1,000 again to get 0.00215 kilograms. So let's go on to more conversions. Now, like I said, they're going to get a little bit tougher. 1/4 of a pound to milligrams. Confusing, right? Well, that's the point of these exams, is to try to confuse you. Nursing instructors are evil. Trust me. I know you're thinking about yours right now. Just think about it, scream the name out loud, and throw a punch, but don't hit the screen. Don't do that. Just scream. It lets off stress. So 1/4 of a pound to milligrams. Well, first off, you got to get away from pounds. Pounds are big. Pounds are just flabby and gross. You need to go to kilograms, right? So 1/4 of a pound. Well, first off, 1/4 pound is not even, you can't really do much with a fraction. So if you take 1/4, 1 divided by 4 is going to give you 0.25 pounds. Don't make that mistake. Do that one right away. So you got 0.25 pounds. 0.25 pounds to kilograms. How do we get that again? Remember, pounds are larger numbers. So 0.25 pounds divided by 2.2 is going to give us a smaller, petite number. Remember the pounds just piling up on the midsection or your thighs or wherever it goes. They're smaller in kilograms. We like that metric system. It's so cute. So 0.25 divided by 2.2 is going to give you 0.1136 kilograms. A smaller number, right? But that's not where we're going to stop. If I was an instructor, I would put this on your exam as the possible answer, and I'd get 25% of you every time. I have so much fun just putting my red pen right through your answer, being, got it wrong, didn't pay attention. That's right. Because the answer is not what you need. You need milligrams, not kilograms. Don't make that mistake. Pay attention. So how do we get there? Just a couple more steps. It's easy from here. We know that we need to go to grams first. So 0.1136 times 1,000 is going to give us 113.6 grams. But don't stop there. What you need to do is multiply by 1,000 again to get 113.6 times 1,000, giving you 113,600 grams. That's right. Milligrams, sorry. 113,600 milligrams. And that is the correct answer. What you can see here is this was lots of different steps. And you know what? The math is pretty easy. The steps are pretty easy. But what I can tell you every single time on these daggone tests is something's going to trip you up that's so stupid. And you're going to just kick yourself afterwards. You're going to forget the right conversion, the right fraction, the wrong decimal point. Every single time. You just have to practice and then make sure you don't miss the easy stuff. Don't miss converting to pounds to kilograms, kilograms to pounds. Don't mess that up. And make sure once you're done with the question, stop. And then I want you to say, did I get the right answer in milligrams? Because you don't know how many times you're going to have milligrams or grams or kilograms. And those are going to be your answer choices. And you're going to stop and think you had the right answer. And it's going to be wrong. And your instructor's just laughing, ha, got you. And you're going to be sad because you got a bad score. Okay, now for some other crap that no one uses anymore, but I see it on tests all the time and it just makes me want to punch the screen. Please don't punch the screen. There's three things, really only one of them important. The first one is a dram. A dram is stupid. I don't see it, I haven't seen it or heard of it on the NCLEX or standardized exams for a long time. But I see it sometimes some students used to write into me and tell me that they would see it on their exams. Maybe their instructor truly is evil, also 150 years old. A dram is approximately 8 drams is 1 ounce. Now, what's a dram? Well, it had something to do with whiskey. I think it was Scottish or Irish. I can't remember. But a dram was like a tiny little baby shot of like some whiskey or something back in the day. I don't know, a long time ago. But 8 of them is 1 ounce. I don't really think that one's important. Now, the one that I will see tested a lot, and it's so stupid, I literally hate it, is a grain. 1 grain. So this is one you just got to write down, don't forget it. 1 grain equals 64.79 milligrams, or 65. And that's pretty much all you really need to know. Now, just for fun, because once in a billion years, I see this as a scruple. A scruple is an apothecary term, and it's equal to about 20 grains. Not going to see it on any standardized exam, but for those evil nursing instructors out there, especially the nursing instructors, I see it pop up from time to time, and I get somebody who writes in and says, what's a scruple? Why is it on my exam? Why do I hate my life? Why did I do this? Well, now you know, 1 scruple is 20 grains. 20 grains is, 1 grain is equal to 64.79 milligrams. You can do the math. So just know grain. 1 grain, 64.79 milligrams. I like to just remember 65. Because you know what? 65 is the retirement age, in my opinion, and you're out of here, just like grain. Should be gone soon. I can't wait. Now, more practice questions. These are the real life practice questions, the ones that are hard, the ones that are going to make you want to just love your life and get so excited. Oh my goodness. And I just like to point out, again, we got lots of my crazy images in here from the Picmonic learning system. You can check them out yourself. Now, when you're answering these calculation type questions, you've really got to make sure you don't miss any of the easy stuff. Math is so easy. You guys can do this. You know the multiplication tables, right? But what happens is you get so obsessed over setting up a question, doing lots of things, you forget all the easy stuff. So what are some things you really need to know? in general, this applies for all pharmacology math. You really got to say, what's the question asking me? What is the question asking me to do? Don't forget that. What's the total dose that I'm supposed to give? What have I been given? Don't miss that. And of course, make sure you convert everything to whatever they're asking you to give, and then calculate to that form, and then calculate the dose. And we're going to go over some examples right along here as we go over more real-life questions, which are more fun or more difficult, whatever you say. I don't mind. But one thing that's important, and you're not going to see these usually on pharmacology math if you're in a pharmacology math test, but you may see it if you have a combined test where math is part of your nursing curriculum or whatever curriculum you're in. The administration, 5 rights of medication administration. These are so important. And I see this also applies to real life. Medication errors are very, very, very common, and for dumb reasons. And you're going to think of it afterwards, I just don't know why they did that. Well, they messed up their rights of medication administration. You're giving it to the right patient at the right time. Is it time for that? Are you giving the right drug? Is the drug appropriate? And is it the right route? So routes of administration, we're going to make a video on that. And is it the right dose? The right dose, the right amount, the right time, the right patient. Don't forget those. And of course, the right to refuse. Patients can always refuse. They always refuse the good medication. Don't forget, they don't refuse that pain medicine, do they? No, never. You'll get there. And then, of course, the right documentation. You've got to document. And of course, the medication rights, you see some different variations of this, but they're pretty much the same. Now, let's get on with those practice questions. A provider has ordered azithromycin 0.25 grams PO to be administered daily. The nurse has 125 milligram tablets on hand. How many tablets should the nurse administer? I think I almost said nurse, I'm not sure. Now, what do you need to do first? Now, this question may come super easy to you, and if it does, good, great. But don't miss the steps, because you're going to miss things later when maybe you're not paying as much attention. So what's the first thing you need to do? Well, what is the question asking me? Well, it's asking me how many tablets should the nurse administer? How many tablets? How many tablets of 125 milligrams should they administer? Well, you want to administer 125 milligrams, but the order, you have 125 milligram tablets, but the order is for grams, 0.25 grams. So you've got to convert. So what you need to do, of course, is say how many milligram tablets daily in your question, and then the total that you need to actually give. Azithromycin, 0.25 grams PO, PO means by mouth if you haven't got there, and every day. And you've been given the 125 milligram tablets. So let's calculate it. 0.25 grams means nothing because you have 125 milligram tablets. So remember our little conversion, grams to milligrams. What are you going to do? Multiply by 1,000. Yep, we know you're screaming at the screen. And that equals 250 milligrams. So you need to give 250 milligrams every day. That's your dose. Well, if you have 125 milligram tablets, what do you do now? Well, you've got 250 milligrams to give, and you take 250 milligrams, you divide it by the amount you have on hand, 125, and it's going to give you 2 tablets. So the answer, 2 125 milligram tablets PO daily for azithromycin. That's your answer. You can play it again and really think through it to make sure you got it. If this confuses you, you probably missed one of the steps. Just take a step back and follow along. Now next, this one's great. An order states you must administer metoprolol succinate 400,000 micrograms twice daily. How much do you administer each dose? You have. And it gives you one of those lovely little drug labels. I love drug labels. These are the best questions. Honestly, I hate these. They gave me anxiety when I was in school and I wanted to die. However, you've got one. Merry Christmas. Now, what do? Well, what's the answer? Take a second to see if you can figure this out. Did you get the right answer? Well, this is a trick question because I'm an evil nursing instructor, and if I was your instructor, I would be laughing all day, just marking X's all over the place, having so much fun with you. Why? Because you missed up one of the most common rights of medication administration. Because you know what this little nugget says? Ha, ha, ha. The rights of medication administration. Now, maybe you don't know that metoprolol succinate is different than metoprolol tartrate. Well, I'm sorry. I'm an evil nursing instructor, remember? That's right. And that's what's going to happen. I doubt that you're going to really be given this, but I put this in here to make an evil point, and that is you've got to read the question, because so many times in the questions you're going to be given something that's just so off. It's going to be just one word off, and it throws the entire question off every single time. Well, good for me. I'm going to put 1 for Dr. Wyatt over here and 0 for you. Unless you saw it, and then, well, we're going to give you a half point for a good merit. So what's the point? Well, metoprolol succinate, you can see here on the label metoprolol tartrate. And what I can tell you, on a standardized exam, it's going to say exactly. It's not going to have any other weird crap on there. And that's what's really important. Now, can you answer this question? No, you can't. Because if you picked 2 tablets, you did the right math, great for you, but you're wrong. Because you can't give the wrong medication. And actually, metoprolol succinate is a long-acting medication, and tartrate's a fast-acting medication of the exact same medication. They're just different formulations. So you would have doubled the dose of the patient. Bad for you. The answer is there's not enough information, or it's incorrect. That's what's important. Now, let's look at another one that maybe is a little more appropriate. An order states you must administer metoprolol tartrate 200,000 micrograms twice daily. How much do you administer each dose? You have on hand another drug label. What's the answer? Take a moment to see if you can figure it out. Of course, this medication is the correct one, because I tricked you last time. Why would I do it again, right? Did you get the answer? Well, let's work through it together. So 200,000 micrograms twice daily, that's what you need to give. So what you need to do, of course, micrograms is not going to do you any good. What you know is, well, what's in the question and what's the answer need to have? Well, the answer needs to have milligrams, and your question has micrograms. So the first thing you should do is convert everything to what you have on hand, or what the answer is. Now, you have 200,000 micrograms. 200,000. So 200,000 micrograms. Well, what are you going to do to move that to milligrams? You're going to divide, because it's going over, right? And if you divide 200,000 divided by 1,000, it's going to give you 200 milligrams. So then you know, how much do you need to give twice daily? 200 milligrams twice daily. Makes the question a lot more simple to be able to answer in your head, right? So if you need to give 200 milligrams twice daily, well, what do you need to do? Well, you need to take 200 milligrams and divide it by 2 to give you 100 milligrams. Okay, makes more sense. Now you need to give 100 milligrams twice, 100 milligrams each dose twice daily. So then you're going to be able to see that you need to give 1 tablet each dose. And what's going to happen? You're going to get a lot of these. These are actually really simple questions. But if you don't follow the same process every time, they're going to trip you up. You've got to take a step back. Number 1, read the question. Number 2, make sure you're given the right amount of what it's asking you to give and what the answer says. Because metoprolol tartrate, as you can see, you may get tripped up by one of those easy little tricks. And I have so much fun doing those every single time. But don't miss the easy stuff. And these are actually really easy questions. You're going to look at these 5 years from now and you're just going to laugh at how easy they are. Yeah, I know it seems hard now. The answer is 1 tablet. And if you got that, good for you. Now, let's move on to another lovely question. I know you're so excited. A physician has ordered amoxicillin 1.5 grams over 3 timed and divided doses daily. Which of the following should you administer? Take a moment and see if you can get the answer. Did you get the correct answer? Well, what are you supposed to do here? What is the question asking me? Well, it says I need to administer amoxicillin 1.5 grams over 3 timed and divided doses daily. So, there's a couple of different ways to go about tackling this one right away. But you can look at the answers. Well, you can read all the answers ahead of time, probably just going to confuse you. But what's important to know about the answers is all of them are in milligrams, or not enough information. I always just, when I guess, just pick not enough information and move on. Next question, I don't know. No, don't do that. That's a bad answer. So amoxicillin 1.5 grams over 3 timed and divided doses daily. So how long is daily? 24 hours. That's right. Good for you. You passed first grade. Second grade, I don't know where it is. What's important to do first? Well, first off we know we're given grams. And we need milligrams. So we've got to convert grams to milligrams. Make sure you don't miss the easy stuff, remember? So first, we've got 1 grams in the question and milligrams in the answers. So 1.5 grams times 1,000 is going to give us what? 1,500 milligrams. That's the first step. What do we need to do next? Well, one of the next steps is really to say, well, we need to give 1,500 milligrams in 24 hours, right? That's the total in 24 hours. But that's not what the question's asking us. Some questions do. This one's saying over 24 hours, we want to give 1,500 milligrams in 3 timed and divided doses. So what does that mean? Well, how many hours are in a day? 24. How many would 3 doses be? Well, that means it's going to be 3 every 8 hours, right? 3 goes into 24 8 times. So 8 every 8 hours. So, of course, if we take the exact same thing and we have our 1,500 milligrams and we divide that by our 3 doses, that's going to give us 500 milligrams each dose. So 500 milligrams, and how many 24 hours? Here we go. 24 divided by 3 is going to give us every 8 hours. So every daily 3 timed and divided doses, 24 hours divided by 3 is 8 hours. So the frequency is every 8 hours. And our dose every 8 hours is 500 milligrams. But we're still not done. And that is why these questions are so confusing. So what happens is if you really can't think through it and conceptualize what's going on, you get confused because the answers here are very confusing. They're made to trip you up because I'm an evil nursing instructor, remember? I really am. Look at this. This is the face of evil. Evil. Anyway, sorry, I couldn't help it. What are the choices? Well, we know if you're really good, and you know that, first off, you figured out 8 hours. Let's say you just got that. Well, there are 4 choices here with 8 hours. But maybe you made a little shortcut and you know you just need to give 500 milligrams. The answer you thought you needed to give was 500 because you stopped there, 500. You would have picked number 4 and you would have been wrong because 500 milligram tablets every 6 hours. Make sure you read all of the answers. So if we need to give 500 milligrams every 8 hours, there are no 500 milligram choices in our answers, right? Because it's even more complex. And that's what you're going to see here. 500 milligrams every 8 hours. Well, 6 hours is out. So number 4, just scratch it off the list. What do you have left? Well, you need something that equals 500 milligrams every 8 hours. So you have to reverse engineer the answers. So 1 300 milligram tablet? Nope, wrong. 1 250 milligram tablet? Wrong. 2 250 milligram tablets every 8 hours? Sounds right. It's not, oh wait. What's happened now? More evilness, right? Yeah, exactly. 1 250 milligram tablet 8 hours is wrong. But 2 250 milligram tablets every 8 hours, that's correct. That equals 500 milligrams every 8 hours. But number 5 is 5 100 milligram tablets every 8 hours. Oh my goodness. Must have made a mistake, right? No, this is an evil question. There's lots of evilness in here. The amount of evilness in this question, you have no idea. So what's the correct answer? Well, if I was going to give you some pills, how many pills would you really want to swallow? 1, 2, 25, or 100? It's not 100. It's not 25. You want to take the least amount of pills possible unless your pocketbook can't afford it. But on the NCLEX and every other standardized exam, you can afford it. So the answer is the least number of pills possible, even if it's the same dosage. And that's the answer. So what's the answer here? It's not 5 100 milligram tablets every 8 hours. It's 2 250 milligram tablets every 8 hours for a dose of 500 milligrams each 8-hour dose for a total dose of, you guessed it, 1,500 milligrams or 1.5 grams. Wow, that was really confusing. That's right, it was meant to be. These are the kind of questions that if I wrote tests, I would put these at every single question because they're so fun and I just like to sit back with my big red X and just mark it all off. as people get them wrong. But it's so easy to take a couple of steps back and just apply some basic principles. Number 1, make sure you're always putting it in the same form, grams to milligrams. You need to convert. If you forgot to convert here, you probably got it wrong. And, of course, making sure the last little step that I didn't put in any of the other questions are, you need to have it in the smallest amount possible. You're very likely to see 2 of the exact same dosages that are correct, but maybe one has 5 pills and the other one has 1.3. I don't know. But, or 4 pills versus 1. You always want to have the least number of pills possible, and that's where just some more evilness likes to take effect. So the answer is number 3, 2 250 milligram tablets every 8 hours. Here's one more question. A physician's ordered 0.27 milligrams levothyroxine now. Which of the following should you administer? And here's another drug label. Synthroid, levothyroxine sodium tablets, 137 micrograms. Shucks. So what's the answer? Well, this one's actually not that difficult as the last one. There aren't nearly as many tricks in this one, and that's on purpose to make you feel a little bit better so you don't cry when you go to bed tonight. 0.274 milligrams is what you need to give, and you have micrograms. So what do you need to do? Well, if you have the questions in milligrams and you need to give micrograms, because that's the tablets you have on hand, what do you need to do? You need to convert. 0.27 milligrams times 1,000, remember, equals 274 micrograms. That's really important. Don't miss the easy stuff. If we have 274 micrograms we need to give now, remember, this equals the dose we need to give now, then what we need to do is take what we have on hand. My head itches. Take what we have on hand, which are 137 microgram tablets, and divide that into the dose we need to give. 274 micrograms divided by 137 equals 2. Did you get the answer 2? I hope you did, because there's no evilness here. I didn't do that to you, but I bet you read this question carefully, didn't you? You did. You're welcome. The answer is number 3, 2 tablets. So you're going to give 2 tablets of the medication. Don't miss the easy stuff. Even though the questions seem easy, I guarantee you there's tricks in there because I'm not the only evil nursing instructor out there. Well, wasn't that fun? That's it. That's all we've got today. I really appreciate you tuning in. Check out lots of our other videos. If there's something you're interested in, you want to see, you need to learn, I don't know, send me a message. You can go down there and push the little like and subscribe button, and you can check, oh, there it is, right there. You can check out the other videos by clicking there. Subscribe, like, share with your friend, I don't know, tell your dog, I don't know. We appreciate you watching today. I'm Dr. Kendall Wyatt. Good luck studying.